Good morning, good afternoon, good evening. I'd like to warmly welcome you to this webinar here today, which is on the session on talking interoperability. Looking at the audience, we can see here, I'm happy to see the continued interest in digital social protection and these spaces here, which allow for cooperation amongst development partners conceived in a large way, but also governments, private sector, and other members of the community. So I'd like to, sorry, the technical issue here. Okay, so my name is Dörte Bosse. I'm the Deputy Head of Unit at the European Commission Director General for International Partnerships, shortly INPA, Unit INPA G4, which is on social inclusion and protection, health and demography. I'm introducing shortly today's session, which this time focuses on Uzbekistan social protection single registry. So just to give you a quick intro on what we are doing as EU as well, as we participate in this convergence initiative, we have been doing so from the outset, yeah? And we just reflect one of the institutions supporting this great new initiative. So just to underline that we in our external action, we frame this initiative under our overarching strategy, which is called EU Global Gateway, and we have prioritized this strategy, the Convergence Initiative, because we want to accompany partner countries in the twin green and digital transition beyond Europe's borders. So we have been investing in this. We are looking forward how we can kind of roll out and best support this initiative. Then just to remind you as well that we do have various programs supporting social protection at large. So this is what I just mentioned, this new support for the digital initiative, the convergence initiative, but we do support many partner countries under our new budget, roughly 14 new programs with partner countries to invest in social protection programs, partially as well linked to digital enhancement, which we consider more and more important. So let's go to the slide on the agenda, please. So you will shortly see here that on the agenda, there's a short welcome. This is me, then the presentation. This is the next one. Then a discussion of half an hour. Then there will be space as well to address questions of the audience. And then there will be closing remarks. So altogether, we will have roughly 2 hours together. To the next slide, please, where we're here today. So the DCI, the Convergence Initiative, is housed under the Universal Social Protection 2030 initiative, but it is a joint effort by USP 2030 members, so by all members of this initiative and non-members, but also governments, development partners, and private sector. We've seen that there are a lot of developments to build up digital systems in different countries over the last years, and this is a positive sign, but we are also trying to build systems that are interoperable at country level, but on the other side, pledging for standards also at global level. Look, I'm not going through all the items which are mentioned here on the side. With this cube on the right side. This can all be found, of course, on the website of the Convergence initiatives as well. Those are the main ingredients of this initiative. So next slide, please. On the dialogue, a monthly, so why are we having this here today? So we do have monthly dialogue series. The idea behind is to have technical discussions to jointly reflect on integrated and interoperable social protection information systems by looking very close at country cases where we can draw lessons of country efforts, because this is the most practical way, I think, to learn about the the challenges, but also about the success stories on how countries are moving ahead. So we are here today as well to brainstorm on potential solutions to remaining bottlenecks. So the aim of these dialogues are also to share solutions and lessons learned, what I just said. So we may have interesting thoughts from the audience that we can take back to the countries where we respectively work. So this is kind of a peer learning exercise here as well from different countries and regions of the world. Next slide, please, on where you can find the previous sessions we already had. So the recordings of the past sessions remain available in the projected link available, but you also find a 2-3 pages note sheet to summarize the discussion of each country cases on this website. The idea is to have a repository of case studies to be used by the whole community. So at the very end here, I'd like to flag some housekeeping rules. So ask your question in the questions and answers box. As already mentioned before, there will be room and time to address those questions. Then secondly, share any comments or resources in the chat. Most welcome, so that they can then be put in the repository. Simultaneous interpretation is available. Select the language in the interpretation icon on the control bar. I understand we will have English, Russian, Russian, English. And just to remind you that this session will be recorded. So I will shortly, this is my last point here, introduce the main speakers around the virtual table here. So as you know, every session of the Talking Interoperability Dialogue Zoom is in a specific country case. I already mentioned this. Today we will focus on Uzbekistan's social protection single registry. I already mentioned this as well. On integrated social protection information platform designed in 2018 already by the Ministry of Finance. This single registry facilitates seamless end-to-end delivery of various programs, including digitalization of the processes of beneficiary registration, eligibility, payment updates, M&E, grievance, and fund allocation through the integrated platform. So the presentation will discuss the architecture and interoperability features of this registry and share the challenges and factors leading to its wide acceptance and cooperation amongst different institutions and sectors. Let me introduce the speakers of this webinar shortly. First, so you have the overview here of 4 speakers. So the social protection system of Uzbekistan will be presented by Umid Aliev from UNICEF Uzbekistan, Rafael Klivleev and Otabek Eschanov from the Ministry of Economy and Finance of the Republic of Uzbekistan, and Dorcas Vansa from Development Pathways. I hope I pronounced all the names correctly. Then, next slide, 3 speakers here. One would be moderating the session while Nitin Amapati and Navid Akbar would be discussants. Let me now briefly introduce each speaker of this session. So you have already seen all of them in the overview. Here we do have Mr. Umid Aliev. He has been working at UNICEF since 2018 and has been specializing on social protection and child poverty. Before joining UNICEF, he did several consultancy projects on economic growth factors, labor market programs, social protection and women employment for UNICEF, UNDP, World Bank and the Asian Development Bank. He has a PhD in economics from the University of Leeds, UK, which he graduated from in 2012. Let me hop now to Mr. Rafael Klivleev. He's the Deputy Director of the Department of Finance and Budget Policy and Social Sphere of the Ministry of Economy and Finance of the Republic of Uzbekistan as well. Mr. Klivleev studied sociology and has held several key positions in government ministries. He played a significant role in the development and implementation of social protection programs, including the Unified Social Protection Registry, here to present, and the Social Protection Strategy for Uzbekistan. He has been responsible for the development of methodologies for the provision of benefits and material assistance to lower-income families, pregnant women, and working women in private sector. Then Mr. Otabek Eschanov. Just 1 second. So he holds a computer science degree from Tashkent University of Information Technologies, 2006. He's currently the director at the Department of Development of ICT, the Ministry of Finance, of Economy and Finance, Uzbekistan as well. From 2020 to 2022, he contributed to IT projects, including procurement of equipment, software development for HR and finance, and integration of government agencies. Then Mrs. Dorcas Swanzer is a digital technology specialist with extensive professional work experience over the last 10 years, bridging business strategy and requirements through technology-enabled solution across variety industry sectors and geographies. She has led an assessment, design, and implementation of information technology solutions for both the business and social protection sectors, including a program-specific beneficiary operation system, SMIS, social integrated beneficiary registry, social cash transfers, and enterprise resource planning systems. Then let's go to Mr. Nitin Umarfati. So works on design of welfare, energy affordability, and labor market policies. He has been supporting systems reforms such in Europe and contributed to the World Bank's flagship East Asia Aging Report, Living Long and Prosper. His publications under wide-ranging topics, including on social protection, energy poverty, education, early childhood development programs, and economic trends of program evaluation, have been widely featured in the Allianz Economist, Forbes, Financial Times, and the Brookings Institutions blog. Almost coming to an end here. So we have Mr. Navid Akbar. He's currently serving as Director General, National Social Economic Registry, conditional cash transfer for the Benazir Income Support Program of the Government of Pakistan. He has over 13 years of experience in the Ministry of Social Development and Family in different positions, and has worked for the Ministry of Finance beforehand. He has extensive experience in designing, implementing, and monitoring social protection programs with a focus on social registries and conditional cash transfer initiatives. Last but not least, Mr. Ole Dotisham. He has been active in strengthening health and social protection systems for 20 years, mostly working with the GIZ and WHO. He led the team supporting the development of Cambodia's IDP poor system that helped millions of vulnerable Cambodians preserve through the COVID pandemic. Since 2022, Ole leads GIZ social protections work in Uzbekistan. A big thank you already ahead of this podium. So I see you have a variety and a rich number of speakers here. I wish you success for this event here today, and I would give back the floor. Thank you very much.
Thank you very much, Dörte, and I shall take over from here. Assalamu alaikum from Tashkent. As Dörte already said, my name is Umid and I lead GIZ's work here in Uzbekistan on social protection. I'll guide you through today's session. Just to repeat one or two things that might be important, we have 4 exciting presenters. They will present now, one after the other, so you'll get the bulk of the information front-loaded, and then we will have an extensive discussion session, including discussants, but also plenty of chance to put your own questions to the panelists. And to that end, I would just like to really encourage you to enter your questions at any time into the Q&A feature that Zoom has. You should find it in the menu at the bottom. We have the simultaneous translation, as Dörte already said. I'd just like to point out that some of the presenters will also be presenting in Russian. So if you don't understand Russian, then you should also choose the English channel now, so you get the full benefit of the translation. And for those who may have not understood me just now, let me just try this. U nas jest перевод на русский язык.
We do have a Russian translation. Make sure you press the right button on the control panel in the Zoom interface.
without further ado, I'd therefore now like to give the floor to Umid from UNICEF. Thank you very much.
Yep. Thank you very much, Ole. Thank you very much, dear colleagues. And before starting, I'd like to thank everyone for this great opportunity to speak such an audience and just to share information about our experience here in Uzbekistan when it comes to building a digital platform for social protection. And I hope that within this presentation, you will see that the journey has been quite rich in general in events, and it had its own ups and downs, but eventually, thanks to dedication of our national partners in the first place and continuous support from UNICEF and also continuous support from our colleagues from World Bank, eventually this journey ended up with a great success, something that we actually can now praise ourselves rightly for. But at the same time, it's by no means it indicates end of the journey. In fact, actually, the fact that we managed to get system in place opened up some new perspectives on actually enhancing further reforms in social protection system of Uzbekistan. And that's something that we would like to discuss today. So now let me share the presentation. So here it is. I hope everyone can see it. And basically, what I'll do actually, I'll try to cover kind of just introductory part of the presentation, speaking that for UNICEF, in fact, this particular intervention was never been only about building a digital platform, because obviously digitalization is an important element in any system strengthening, especially in the context of Uzbekistan. But in fact, something that we eventually managed to achieve is that this building a digital platform triggered some wider scale reforms for social protection in Uzbekistan and allowed us to reform some of the programs and also giving some additional capacity through digitalization to the national government of Uzbekistan, actually to extend coverage by social assistance programs substantially, and also resolving many of the issues related to child benefits in Uzbekistan, allowed us to introduce some new programs. Basically, digitalization itself was an important in order to streamline existing procedures, and something you will see once Rafael will talk about them in details. But in addition to that, we actually had a chance to actually reform some of the programs and even introduce some new benefits for those parts of the population that were covered by them previously. So let me switch now. How do I do that? No. Yeah, here it is. So now, if just to summarize the main achievements of the cooperation with UNICEF and the Ministry of Economy and Finance, and obviously the first one would be development of single registry itself, and the details of that and the final outcomes of this journey will actually be presented by Rafael. But I would like to focus that the progress within that particular reform path when it comes to development of single registry allowed us to actually undertake further reforms related to building proper institutional capacity when it comes to interagency cooperation, coordination within social protection system, which is still institutionally remains fragmented. We still don't have, like, let's say, like consolidated state agency responsible for social protection. But now, thanks to consolidation that happens digitally around single registry, we have now strengthened understanding for the institutional reform on consolidating institutionalize the system as well. Another achievement that came to, within that cooperation between UNICEF and the Ministry of Economy and Finance, obviously been development and adoption of the National Social Protection Strategy for 2022 and 2030. And here I have to mention also contribution from the colleagues of by ILO and the World Bank and UNDP. And also another major achievement, it's been actually, as I mentioned, like at the beginning, digitalization, enhanced capacity of Ministry of Economy and Finance to deliver social assistance programs. And as a result, actually, it opened us then opportunities to start reforming existing programs that actually came at reforming child benefit. An example here, I can say that, for example, the maximum eligible age being extended from 14 to 18. Or like benefit amount has been increased and they've been actually reformed from being family-based to individual-based. And all in all, now we have, if we at the beginning of this reform path, we started with 13% coverage. Now it's actually been increased up to 26%. So actually double coverage for by child benefits. And another reform that actually been made possible thanks to digitalization. It actually been introducing allowances for caregivers of children with disabilities, and then something that we also did relatively recently, it's actually introduction of state compensation for maternity benefits for women working in the non-state sector. Some further details of these particular reforms will also be provided by Rafael. And the final thing that actually at the moment that we're working on is moving beyond social benefits only, now trying to actually link social benefits with social services through actually introducing the system of community level social work based on case management. And that's something also happens being based on single registry. So the work that we started on digitalizing provision of social benefits now being extended in the area of social services. So and here I'd like to stop and now pass it over to Rafael, who will continue with now a focus on single register development and take you through the entire journey on it. Thank you.
Yes, thank you very much. Hello, everybody. Good morning, good afternoon, and good evening, dear participants of our webinar. If I continue the ideas that we have been discussing about the unified registry, the single registry, the main aim was to create a transparent, just system of providing benefits to the community by the electronic interaction between all the ministries and state bodies of Uzbekistan. The aim was to lower the subjectivity, to automate as many processes as possible, and to exclude the human factor. The system was developed with the support of UNICEF and the World Bank, and we used the grants. The system itself was initiated, the development of the system started in 2018, and in October 2019, we launched it in one of the smallest Uzbek regions in the Sirdarya region. And less than in a year, we unfolded it on a large number of regions throughout the Republic. By December, it was launched in all the country's regions. Now, today, at that point, the single registry was covering only the children's benefits and one more type. And today we have 4 types of social benefits included in it. So this is the way the system was unfolded. In September 2020, it was 5 regions. In October, 3 more regions. In November and December, the remaining 5 regions were joined into the single registry. The introduction of the system has allowed us to simplify greatly the process of submitting the request. On the left, you can see how the system worked before. We have the Mahalla committees that were receiving the queries, the applications, and there were 2 commissions created. One commission was studying the income and the property status of the family. Then there was a big commission that was making the decisions about assigning or rejecting the social benefits. There was the chairman of the committee and the members of the Mahalla committee and the honored citizens who live within this Mahalla. And then, based on the decree of this commission, we made a document in 3 copies. One stayed there, the other one went on to the financial bodies, and the third to the Halk Bank, and that was all paperwork. Then, based on that, the financial bodies checked the presence of the funds in the social protection organizations, and then the money was redirected to the bank, and then the bank executed the payments. After the single registry was introduced, the application is submitted to the Mahalla committee, but there are no committees, commissions. The committee just takes the applications and transfers them to the district department of the pension fund, where the information is entered into the single registry, and it automatically finds the necessary data and defines whether the applicant should be given the benefits according to the framework that we have inserted in it. So the notification is sent to the person's mobile about the decision, and the pre-payrolls were also generated automatically, electronically, and they were directed to the district department of the bank, of the Halk Bank, and the payments were forwarded to the financial bodies that were directing the money to the bank, and the bank would actually make the payment within the 3 weeks. The money was transferred to the individual account or the bank card, or the payments were made in cash. You can see which state bodies and ministries and information systems have already been connected to the single registry. So in the first place, it's the Civil Registry Office. It's the Department of the Legal Ministry that is responsible for different civil statuses like births or marriages. Also, there is the financial information about the incomes from the Ministry of Finances, and we need to confirm that the person is the citizen, or maybe the person without citizenship, or maybe a foreigner. Also, there is the pension fund, the Ministry of Internal Affairs, the tax committee. You see different bodies that submit the corresponding information. So today it's over 16 ministries and social and state bodies, and we get over 70,000 of types of information of different kinds. Excuse me, please, for the noise. Please, I apologize. Let's continue. Let's have the next slide, please. So here you can see the stages of the process of submitting the application and of the payments being assigned and paid. Until the 15th of the corresponding month, the citizens can submit the application at any moment, but after the 15th, it will be reviewed in the next month. So every 2 days, every 2 working days, the Mahala committee collects the applications and transfers them to the pension fund, and there the data is introduced into the system immediately. After the information is put in the system, the necessary data is collected automatically, and after that the information is analyzed, and the decision is made about assigning or rejecting the payment, and the pre-payroll list is formed, and the money is requested. All that is forwarded to the financial organs, and then the bank transfers are being made. After the transfer arrives to the corresponding department of the Halk Bank, the payroll is automatically forwarded there, and the payment is performed. At the end, after all the payments have been made, the Halk Bank sends an electronic report on every applicant about the payments or the absence of payment or the money that was unclaimed. That is transferred to the next month. here you can see some important dynamics. What was happening before the single registry was introduced and what happened after that. So you can see the number of families that were receiving social benefits in 2016. You can see that the coverage was about 500,000, less than 500,000 families. And stage by stage, after the single registry was introduced, the number of these families was going up and up. We can say that before, the Mahala committees had limits of budget, according to which they were approving or not approving the applications for social benefits. They were asking the citizens to try and apply the next month because they've used up the limits. So with the introduction of the single registry, the limits were completely taken away, that we take all the applications when they are made, and right away we define the need for the social benefits, and over 6 years, the number of recipients of these benefits increased 5 times, and the amount of benefits themselves increased 10 times. That's because we introduced a new child support benefits. Before, we used to have the benefits for the families with children under 2 years, and now we have the benefits for the children under 14. The single registry processing the processes information about low-income families. Automatically we get the certificate, and based on that certificate, within 12 months the people can get additional free services guaranteed by the country. It's the healthcare, it's the subsidies for housing. There are subsidies and support for education, and you can get a special condition credit for the children's education and other social protection programs. What I told you about right here, starting with September 2021, together with UNICEF and the World Bank, we have developed some initiatives. We directed them to the government, and both of them, both of the social benefits for the families with the children under 2 and under 14 are being developed. And there is also a child allowance to up to 18 years. So if the previous benefit of the children under 14 was paid only for 6 months, this new one, the allowance for the children up to 18 years old, is paid for 12 months. So now, according to the national legislation about the children's age, we brought the age of the children that are eligible for the benefits up to 18 years. Before, the benefits for the children under 14, the benefits were different for the families with 1 child, 2 children, and 5 or 6 children. If it was 5 or 6, it wasn't different, but before that, under that, it was different. Now, we also have a different system. If there are 10 children in the family, the benefits will be bigger than for the families with the smaller number of kids. At the bottom of the slide, you can see the specifics about the number of children and the benefits for each child. The third and next children are getting smaller benefits. We also taking into consideration the fact that in Uzbekistan, social protection has always been a priority, and there have been a lot of initiatives of the social organizations working with the disabled children. The parents who are taking care of the disabled children and cannot work because they cannot leave their child who is in constant need of care, there is a separate allowance. The children themselves get the benefits, but in addition, we pay the benefits for the family, and it is connected with the minimal consumer expenses rate. We outlined 34 different conditions, health conditions, which are eligible for this allowance. So around 60,000 people receive these benefits today, and we spent over $15 million on that in 2022. But thanks to the unified register, single registry, we introduced another type of benefits. This is maternity benefits to women who work in the non-state sector. So if they work in state companies, they receive the benefits from the budget, and in the non-state companies, it's all the responsibility of the employer, and they get the tax incentives. So we made a decision to introduce step by step, covering these expenses for the employers by the specially created fund of social insurance. And starting with the 1st of September 2022, we have been paying this for 4 months. And it's a proactive allowance. The woman receives the sick leave, and automatically the benefits are assigned. I'm very sorry, we don't have our own office, so I'm forced to share this space. So the electronic sick leave is introduced into the information system, and it is available in the single registry. And the registry starts checking whether this woman is eligible for this sort of benefits. The criteria are having the history of work in this company for 6 months at least. The organization has to be a registered legal entity, non-state company, and at the same time, we are checking if the person has received some social taxes, maybe they're working in some other place, and then we create the payroll and forward it to the bank, and the bank finds active cards assigned to this person, and the money is transferred on those accounts. Then in a while, through the organizations of civil registry, we check whether the birth happened or maybe the child died. So we double check that the woman is not cheating us, that the woman was pregnant and she actually started the maternity leave taking care of the child. And in 2019, we introduced the single registry, and then it was rolled out in the whole Republic in 2020. And we have been perfecting the methods and the technical sides of it. So when the benefits are assigned, we take into consideration several things. When one of the parents takes the maternity or paternity leave, we don't believe they're unemployed. We also cover the military service, and there are some categories that are included in the iron pad of the government. Then the families with 4 or more children, students at different educational institutions, the people who have signed up to the single national employment system. We also believe them to be eligible for the benefits. And we also deal with single parents or guardians who take care of their children by themselves. Next slide, please. What do we see as the possible ways of widening our efforts of spreading the system? Today, thanks to the credit from the World Bank, we have bought 10,000 tablets. We have about 9,500 mahalas around the Republic, and in every one of them, there is a women's activist, and their main task is to study the problems of women and families and to help in solving those problems. So we bought special tablets and developed this special software of case management. When you input the information about the family, they form the individual program for relieving the difficult situation of the family and their need for the state services. So we brought our services to the roots to stop people from going to the capital. We are trying to bring these services to every citizen in the country.
Without having to do all of the necessary forms and paper through the electronic system. Right now, the program has been developed with the ministerial support and approved in one of the districts, one of the regions of the country. Right now, it has been spread throughout the country. We are monitoring the services being provided as they enroll, and starting with March or April this year, 2023, the program will encompass the entirety of the Republic, and all of the activists and all of the workers will have the capability to provide social benefits at their place of residencies and work. And right now we are discussing the governmental regulations necessary for the paperwork, the case management to come through without having to do through Mahala committee, by just using their local activist, local representative. Right now, the register encompasses all of the types of social support we are providing to the population, that also gives us a clear picture of the social situation in the country, of the families, individual families. We know which types of support are more in demand, which types of support are less in demand, so that we could more flexibly plan the budget, or perhaps plan for new types of social protection services to be implemented in the future. On this slide, you can see what we mentioned, what we meant by providing all of the services through the activists. This includes the family digital passports. This includes needs assessment and drafting the individual social support plan for the family, and the inquiry for delivery of social services. It also includes monitoring and evaluation of effectiveness of these measures. All of this is gathered, all of the data is gathered in the single registry, which provides us with a clear picture and clear way to make decisions. And so these women's activists will be transformed into social workers down the line. This is what we have planned from the outset. We have created a special ministry for minimization of poverty and improvement of employment, and then formally this ministry that will be dedicated just to that, improving employment and reduction of poverty. With that, I would like to conclude my presentation. I'd be happy to take questions, and thank you for your attention. I hope you can hear me.
Yes, we can.
Can you please take the technical questions that have been sent to Q&A box?
Я хотел сначала сказать, там у нас на чате
Before I do that,
вопрос-ответе 3 вопроса пришло.
before we
Может, ответим?
do the next presentation, could we perhaps proceed with Q&A first? Yes, I agree.
All right, then let's have a couple of questions now to loosen this up a little bit. We have at the moment 4 questions being asked by the participants, and I shall take the first one, which is from Sarah Blinn. It says, could you describe the mechanism, if any, through which the single registry is used to facilitate case management for those who may need the support, for example, of a social worker or an employment social worker?
I think it will be easy to answer Rafael. Rafael, okay?
Could you take that question, Rafael?
If I may have the question repeated, please. I'm not sure I get it quite correct. We can address the question again, perhaps.
Umid, did you just explain the question, or? Sure, go ahead now. So it is my understanding you just translated the question. So would either. Right, go ahead with that, but then I would like to also move on. But go ahead and explain the question, please, to Rafael.
So the question was, what sort of mechanisms are there within the single registry to facilitate case management for people requiring support, in particular the social workers and people, well, doing the support itself? Again, the question is what sort of mechanisms are used, are there within the single registry to support case management for people requiring support, in particular the social workers. Let me be brief taking this, but let me also be informative with my question. Our program entails Mahala and embedded women's activists who had their tablets, and they approached the families explaining the existing measures for social protection. They take questions from the questionnaires. They find out what sort of social protection measures are required. And then the system automatically decides on which sort of organizations, state agencies, get notified as a result. If it's a healthcare issue, then the healthcare ministry gets inquired. If it's an education matter, the Ministry of Education will be notified. And these are automatically traced, and whether or not these have been worked on or not, whether or not something has been done. And if not, that's also tracked. While the people receiving the service receive recommendation on who do they need to approach, how do they need to register with, let's say, a employment agency as an unemployed, and they will receive either benefits or extra education. And in case, for example, they have a profession but don't have a job, they will receive information about the existing vacancies, and then they can approach a company for employment. The entirety of this work is done as a single registry, and the case management is one of the modules integrated into the single registry platform.
Where we can actually see that there is a module called social service in a mahalla, which is actually a module within single registry, and that one will be designed specifically for the purpose of implementing case management based social work in mahallas, local communities. We call them mahallas here in Uzbekistan, and basically you can see the kind of major functions that are covered by that module. And that module is actually specifically built on to help those like community level social workers, which are women activists in our case. And the major things which the module does now is that collect information on the needs of the families, and then to develop that individual needs-based social support plan for each family or individual we applied. And then, whenever, if services are basic, they can be provided straight away at the local community level, or if services require like specialist intervention, then those services are referred. And that's what we're working now to enhance that particular functionality. So to integrate it with all the major social service providers. And you can actually see some of the examples on the slide. And obviously, I mean, there are functions related to monitoring and evaluation, something that Rafael also mentioned, that the aim actually is to build a comprehensive system of social protection, that there will be actually information about all services provided and all services required in the first place, so therefore it will then allow us to get information on the availability, accessibility of those services and the effectiveness as well. So basically, if we have any gaps in service provision within any particular regions, and whether those services are in place whenever they are required, and if they kind of claim it to be in place, are they actually delivered? So, but that's something that we're working and plan to work within 2023.
Thank you, Rafael, and thank you, Umid, for that reply. I need to hold this for a moment here because we still have more presentation, and we also have two discussants who also have other details to add. So actually, I would like to go back to the presentation now in order to ensure that we have enough time for all the different parts of the session. I would like to remind everyone, please do feel free to enter questions into the Q&A section of Zoom. You may also vote up questions that you find particularly useful, so they will be answered first. For now, though, I'd like to continue with the presentation and I'd like to give the word to Mr. Otabek. Thank you.
Thank you. Did you hear me normally? No problem?
Yes.
Thank you. Can you do next presentation? Okay. Okay, can you open second presentation on SR technical? I will explain over the one presentation. Next one. No, next one. Yes, this one. Yes, this slide. Okay, hi everyone. My name is Otabek Eschanov. I'm a director of ITC department, Information Technology Department, Ministry of Economy and Finance. I'm working in the last 3 years. When I was beginning in here to work, 2012, it was the beginning of this single registry system. It was a small system. It has got 50 users at the moment. This system have got more than 30,000 of users. For that last 2 years, we technically more change was doing. For that, I'll explain of the how it's working. You can see in the front of Angular UJS and the background is working API.NET and the database layer is MySQL. And after that, we do special servers and it's on the another server. It's AP server because we have got more than 15 ministry and more than 60 of information APIs, which is changing informations. Information is changing only over the PNFL. PNFL is identification number of peoples. For that, we have got to identify numbers, and external database. You can see it's external database, which is another ministry, and we are getting from this information. At the moment, we have got we are doing next level, which is after payment analyzing, which is you can say BI, business analytic, how much percent is perfectly, how much percent is through giving, and how many people are dying or else. Everything we are checking at the moment. I'm sorry for that because I'm a technical people. I want to understand how is working system and technical side. And first question was like that: do we also have information integrated with ID systems, SRV systems, payment system, information systems in Uzbekistan? Yes, in Registry 100% integrated with ID system, which in the Ministry of Internal. We are getting all of the information from civil status, marriage registration of marriage, information about birth or death. And the third one is a payment system. Payment system, we are directly connected to central bank. We are sending the informations, which is a cyber security channel to this central bank. After central bank, we are sending, which is a bank, half bank, over that 80% by the card, 20% is cash, 80% is going on the card payments. And the next question was anything on data standards, data format, agreements, register, catalog of standard for data elements. How the APIs published on catalog, do they have any IP gateway connected between SR and other 30 ministers? I will answer these questions like that. You can see technical view in 2012 too, until 2012 too, we have no API server, because we see it's a lot of changing information for the 2012, beginning of 2012, we do another server which on the API servers, which is changing all of informations. For that, you can see in here I've got a service, another service, and we are doing another ministers by the technology agreement. We are by signing two of ministry. Okay, next question: is one minister equal or to one system or multiple systems in the ministry? One ministry equal to multiple system with ministry? Answer like that. We have got we will sign, for example, tax incoming have got 5 APIs, which is separately. We will sign technical agreement for each one. For that, in one ministry, we have got 5 or 6 informations. For each one, we will do technical agreement, and we will do another separately APIs, because, for example, we will send a PNFL, we are getting incoming, second API, we are sending PNFL and getting another incomes. Fourth one is having for example, capital market incomings. For that, we are doing separately technical agreement. Next question: it will be helpful if you could help in a shaping presentation to bring out of unique story Interoperability of Uzbekistan. Can also mention how to integrate it Interoperability was a facility at organization, technical level, any resistance and sharing of data. Okay, I'll answer like that. Some resistance to sharing of data was addressed by the exchange through the electronic government. This approach is facilitate data sharing. In technical views, SR article, you can see in here one line, public portal, e-government. We have got integrated this portal because who do Uzbekistan using this portal because everyone can connect and can get more than 20 kind of informations and answers. If you got any questions, I'm ready to answer. Thank you.
Thank you very much, Mr. Otabek. Given the time where we are at, I think I would like to hand over the floor to Ms. Dorcas.
Good afternoon, good morning, and good evening to everyone. So I'm just going to quickly take you through the SPSR, the Single Registry Technical Overview, and the current government support from the government team. Umid, are you sharing your presentation or should I share from my end?
No, I was sharing it, but let me read. Something happened on the second.
Okay.
Yeah, sorry about that. Yeah, here it is now.
Okay, no problem. So just go to the next slide, please. So this is the functional overview of SPSR. So SPSR is built with 9 modules, as you can see on the diagram. 7 of them are supporting the program's business processes, and then 2 of them, the settings, the security management, and the data analytics, they cut across all these business modules. So the first one is the registration module. This module captures the applications for the benefits. Then the second one, eligibility, it reviews the data received from the applications to see if the applicants qualify for the benefits. So if they qualify for the benefit, they're enrolled into the program. Then the next, the payments are processed. Then we have a grievances and complaints module where program beneficiaries can share any complaints they have, or they can give feedback about the program. Then we have a case management module that manages the beneficiaries' data. If they want to update maybe the family members, they want to update their bank account. So that module does that. Then we have the e-case module that Umid was talking about. This is the social services. So this just does needs assessment to program beneficiaries and allocates them services, then managing the service delivery. So these modules are shared across the different programs. The system is multi-program. So in the configuration settings, you can configure the different programs that you have and configure the different eligibility rules for each of the programs. So once, so the functional modules are shared across all the programs. The system is also multilingual. So currently you can switch between English, Uzbek, and Russian. Then the system is mostly automated. So we get data from external databases like Rafael and Otabek have explained through the APIs. So we are going to look at it, how we use this data and how we use it for the applications. So can we go to the next slide, please? So I won't explain this because Otabek has already explained it, but I just want to emphasize for any external database to be connected to a single registry, it must be within the interdepartmental network. So that is what that blue line signifies there. So all these databases that are linked to the system are within the intra-government network. So if you're outside the system, you are not able to, if you're outside this network, you're not able to access the single registry. So for any ministry to connect, any agency to connect, they must be within this network to be able to link to the single registry. Next slide, please. So these are the 4 types of information that we receive from the different databases. So we receive applications data, then we receive eligibility data, then we receive and exchange payment data from the system. Then we have APIs that they just share the information from the system. So from the applications, we receive the applicant details. So when we were talking about capturing applications, so all the users need to do is just to enter the personal identification number, which is the PIN-FL. Then based on that, the system will return the applicant's details, which are the names, the address, where they're located. Then the system also through the connected databases returns the family composition of that applicant. Then it also has access to the births, deaths, marriages through the civil registry. Then we also get the family member statuses. So Umid, if you can just click next, please, so that we can see the databases. So these are how we use these external databases and how we consume the information in SPSR. So for you to be able to complete an application, the system is connected to all these databases on the right. So it's connected to the state center of personalization to get the details of the applicants. It's connected to the civil registry where we receive the family composition, we receive information on marriage, information on births of children, and information on death. Then it's also linked to the Ministry of Health to get, from the Ministry of Health, we get the disability status of the family members. And then from the Ministry of Higher Education, again, we get the status if any of the family members is attending school, if they're full-time, if they're part-time. Then the Ministry of Public Education, again, we get the status of the family members. Then from the Ministry of Internal Affairs, again, we allocate the status. And then the State Tax Committee, we get information on income, and also from the Bureau of Enforcement, we see if the applicants are receiving any money like alimony. So what, through these connections to the databases, the system automatically completes the application form. So all the system users need to do is just to enter the PIN-FL, which is the identifier for the applicant. Then the system from that to get the family composition will get if that applicant is divorced, if they have any children, where are they working. So we also get information on employment, all sources of income we get through the State Tax Committee. So the income amount is used to calculate the eligibility, as Rafael earlier explained. So once the application is automatically completed by the system, the next step is the eligibility. So to complete the eligibility, we connect to additional databases. Again, this is an automated process. So once the system has received all the data, all the required data fields for the applicant, and the application is complete, it's ready for eligibility, then the system will again connect to additional databases. It will connect the Tashkent Cadastral, the regional cadastral, to connect to the internal affairs, the guide, to check any information if this applicant, they own any properties, they own any cars, if the type of the car, the year of the car, and then the employment history of that person. So for the child benefit and the low income benefit, this information, the PIN-FL is entered manually in the system. But for the maternity benefit, the process is fully automated. So to get the registration data, we connect to the Ministry of Health and get everyone who's applied for any maternity leave. Then the system will check these applications through the eligibility process and confirm if they qualify based on the criteria of that program. So once we get all this information, if the applicant qualifies based on the data returned, the data returned from these databases, then they're either send an SMS to be informed that they've qualified or they're not qualified. So after all the qualified applications go to the next stage, which is the payments data. Again, we connect to Health Bank, we connect to the Treasury, we connect to Uzcard to get bank details. Then once we get the applicants now who are beneficiaries bank details, the system pays them through the bank. So the payroll exchange is done automatically again through the integration to the banks. And it's also integrated to Treasury to do fund requests and then to receive again reconciliation data after payroll is processed. Then once that information is linked, then the users again, they're notified. They're notified of any payments. They're notified of any when to expect the payment. If a payment is debited in the account, they get again a notification through the system. So apart from entering the PNFL, which is the ID, during the application process, the rest of the process is automated. So the users they just monitor the processes of the system. So all this happens through the PNFL, which is the unique ID. So previously we had different databases using different identifiers, like some are using the tax number, but currently the PNFL is the unique identifier for all the government databases. So this has been standardized across all these databases. So it's what is used to exchange the data between the different ministries and the different agencies. So on the information side, again, the system is connected to the Ministry of ICT. So if a family has been qualified as a beneficiary from the system, they can get a low income family certificate. So they just need to visit the Ministry of ICT and they can request this certificate from SR, but just using their PNFL. Then we also have, we recently integrated the notebooks, the Women Book and Youth Book and Iron Book. These are just to get information on the people, the beneficiaries who are enrolled in other social programs, just to monitor who's getting what and where the information is coming from. Umid, next slide, please. So once the system does all that analysis, on this application summary, the system creates an application summary. So when you go to that applicant summary, you can see what API analysis were done, what eligibility assessment was done, what was the result. If they didn't qualify and they were rejected, they'll see the reason why they were rejected. Then they'll also see the family members and their statuses. If they have any properties, if they failed because of a particular reason, you can see that. Then you can also see the payment history of that beneficiary, and then all the messages that have been sent to the beneficiaries. So if anyone needs to follow up, the system stores all that information. It will store where we got the information from, why you were qualified or why you didn't qualify, and all how we are making payments to you and all the communication that we sent to you. So the users and the support team can get all that information through the system. Next slide, please. So the system was handed over to the government in 2022. So currently the ICT department is managing the day-to-day support of running of the system, checking if the system is working well. So we have a support structure. So there's a call center staff who they handle any queries or any grievances from the program beneficiaries. And then we have a support team that supports the system operators, if they're stuck or they need any clarification on the system. And then we have system developers and system administrators and analysts that manage the system at the national level. So they monitor the system. If there are any issues with the integration, they can try to sort it out or reach out to the integrated agencies and resolve that. And then at the top here, that's where the private software developers, just in case there are major changes that the national team are not able to handle, that's when they reach out to the private software developers just to get technical assistance and advice on how to handle any issues that they're currently facing. And next slide. Yeah, thank you, Phil.
Thank you very much, Dorcas. That was very enlightening. Umid, I can tell that you are wanting to say something.
Just if I could say, sorry for interruption, Ole, but throughout Dorcas' presentation, actually, I noticed that I completely undeservedly forgot to mention contribution of the colleagues from development pathways in all this, like building and establishing the system. So that's why I'd like to use this chance to explain it to the audience that development pathways, so what development company that was engaged by UNICEF, and development pathway indeed like helped us to at all stages of building this system, from technical conceptualization to building the system from A to Z, and also like even maintaining its daily operations for nearly a year while the dedicated local support team being formed within the Ministry of Finance, and then providing full training to all new members of local team who then took over the system from development pathway. So I think their role within this system building was very critical, and I'm really grateful for the great work that they provided us. Thank you.
Thank you very much, Umid, and thank you to all presenters for this very detailed, very good overview of the system here in Uzbekistan. A few things I took away from this, while I'll leave you some more time to think about your questions, are that it's really, we had it over really from the macro level down to the technical side. Umid, you showed very well how the implementation of a technical tool can also lead to progress in the policy area, stakeholder coordination. Rafael gave us this impressive story of implementation, the nationwide rollout, the high numbers of beneficiaries and of benefits. And then we dove down deep into the IT system, how they're integrated, the APIs and service, and the whole architecture of it. I don't want to take more of your time, and I would like to give the floor to the two discussants that we have invited to this session to please let us know what their takeaways are, and also lead the question session. I would first give the floor to Nitin from the World Bank, and if you can, please also let us know who you would be addressing your remarks to, unless you say it's open to the presenters to decide. Go ahead.
Thank you. No, it's my remarks are in general addressed to speak to the quality of the system. And I frankly am very impressed, especially given the time frame within which the system was built, the comprehensiveness, and in some sense this is fairly advanced and in terms of excellent international practice for other countries to learn from. And what we're seeing in today's world is conditions are becoming very uncertain. We're living in a situation when we're seeing shock after shock. We had COVID, we had essentially, we still experiencing a world of high inflation. Recently, there were earthquakes. So in some sense, resilience of the safety nets systems is critical, and it must have some form of flexibility to scale up rapidly, quickly. And I think to that extent, Uzbekistan has made tremendous progress by investing in a social registry, because it essentially simplifies the process, even if the system needs to be scaled up to cover more population. But more than that, at the institutional level, it introduces essentially more incentives for objectivity, because in some sense, what we typically observe in many countries, you have many programs, and many programs have their own targeting systems. So you end up having duplication, inefficiency, and confusion sometimes. So there is fragmentation. Whereas if you have a common system, a common registry or a platform, then you can benefit from economies of scale. So you can invest in better technology. You're sharing that technology. You're sharing these services. And that's what I'm seeing in the case of this system. And essentially then ministries can focus on their regulatory roles and not worry about implementation as much of individual programs, because they have this common element that is so important, so sort of such a big item, and that is being essentially handled by, I'm assuming, by some kind of specialized agency within the ministry. And the ministry can worry about where to set the threshold, the policy, the rules, and this agency can worry about implementing the rules so that you end up with low levels of exclusion of those who may be vulnerable, and also with low levels of inclusion of those who are not eligible. So from that sense, I think I cannot find anything that I would say could be dramatically improved from what I have seen. So in some sense, I want to conclude with one possible extension of the current system, and it's a remark as well as a question. One of the key benefits of this system is that, as I put it earlier, is the shared services. You can essentially connect to it, both as a provider of a particular government service. If you are a central bank or tax services, then you are providing administrative services via this registry, but also as a provider of social care services or maybe some benefits. You can connect to this system and essentially the population or a subgroup that you are intending to assist is pre-identified, and then within that group it's already much easier to operate. So you can worry about essentially the quality of services rather than issues of eligibility, identification, and so on and so forth. Now, all of this is great, and the question is for the future is that we are seeing that the nature of services is expanding essentially. So there's potentially going to be much more role for private sector as well as NGOs in the future to provide certain services, simply because, in some cases societies may be aging and government may not be able to or may not have adequate capacity to provide all those services, or humanitarian assistance, for example, like we're seeing from recent essentially events in Turkey. The idea would be, is there potential for essentially external players, non-government players, to be able to connect, to be able to say, okay, it's hard for us to identify vulnerable groups, but if there is a social registry, then we should be able to connect to that, identify those categories, and then be able to provide help. So that's something more of a question, but also as a remark, which would be a desirable feature in going forward. That's all from me. Congratulations to the government for implementing this project, and I wish you all the best.
Thank you very much, Nitin. And so the question that is in the room now is, can non-government actors, can they now or can they potentially connect to the system so they can also access this as a targeting mechanism? And I personally would like to add, is there a way, how does the system govern what part of the information these actors would see? Would it be transparent? Would it show all the details of the family, or just the parts that are needed for this particular actor? I would suggest that question may be first on a technical level to Otabek, but any of the speakers, please feel free to take it up. Any takers?
Well, actually, I may begin, but then I probably would be grateful if it could be continued by Otabek and by Rafael. But basically, no, just based on the discussion that I had with these colleagues, all in all, like all this kind of vision that's been described by Nitin, actually, yeah, it is something that we actually have as well for the system. So that's why I was very much pleased to see, like, that complementarity in that vision that we have for that system. In similarity that we had in the vision. So basically, yeah, single registry is meant to be eventually a single system for the entire social protection system. In order to benefit from all this economies of scale and the shared services, and therefore then avoid duplication, something that the system currently suffers. Still, suffering, and that the aim is to also enhance institutional consolidation around the digital consolidation. So basically, that's how we see it, that the reform path is more likely to happen in this country. So now answering the question about external players, then yes, so basically there have been several discussions with the Ministry of Finance some time ago with the idea of bringing now, let's say, like NGOs as service providers, and eventually they would also have access to the system when it comes to like eligibility test, and so they would actually be able to identify those families that should be just should get those services provided by these external players. That's how I think the ministry wants to see that eventually developing. But probably I would like to give floor now here to Rafael and to Otabek if they're willing to provide some more details on that. But to the best of my knowledge, there have been some discussions with me personally, let's say, where we actually discuss this sort of things. But at the moment, most of the service delivery, I mean, those programs that have been mentioned, they're fully state provided, and those social services that we actually were talking about in trying to integrate platforms, of which are also like state-run programs, but eventually they should be. And to be honest, like presence of NGOs and like non-state service providers in Uzbekistan, it still remains quite limited. So there are, I wouldn't say there are no any NGOs providing social services. There are some, but usually the engagement is quite small and remains limited. Вот, Рафаэль, может, вы сами тоже расскажете по поводу дополнительного там социальный заказ, привлечение ННО при оказании услуг?
Rafael, if I may give the floor over to you to comment on the NGOs and other social players. Yes, thank you for giving me the floor. Regarding information sharing for the community, first of all, I need to say that the information is published on the official website of the Ministry of Economy and Finance, and there is a state-run website which allows some kind of information. Of course, that is non-personalized, with no personal IDs, no first and last name mentioned, due to laws regulating confidentiality of such information in the country. In addition, we need to mention that the observatory, the overseeing body for the social protection information, is scheduled for adoption. All of the information, not only passing through the single registry, but the information collected by other governmental bodies itself, should also processed and made available to the population, both the experts and members of the general community. All of this information will be generalized and published at a unified platform. As for sharing information with non-governmental players, there is a strategy for social protection of Republic of Uzbekistan adopted, which lists, among other things, a requirement to adopt a list of minimally available state support measures and adopt the regulation on provision of such services. And later on, we will expand the operations via the single registry, via the social workers and mahalas. These will be monitored, perhaps rethought sometime down the line, and there is a decision by the President of the Republic. This will transfer gradually from the state service providers to private companies. Either will be handed over to NGOs covering a particular issue. I have to say that NGOs are not quite well represented in terms of social services in Uzbekistan. Yes, they exist, and some of them support, let's say, people with disabilities or women in difficult situations. We do have certain decisions already made to support such activities. These will be subsidized in the form of grants, perhaps, which will facilitate the provision of social services to the population. I hope I managed to cover the question, and I'm ready to take the next one.
Sorry, I will answer second part of the question. First of all, thank you for Luis Frota this question. First of all, I can say one thing. Our president Shavkat Mirziyoyev last 3 years focused on the IT, full the government. We have got last year very big projects until 2025, because we are doing more focus on the government to do digitalization. For example, we have got a civil status. For example, someone dead, first of all, you must get that marriage. Without, you cannot go anywhere. It must be. Or you have burned a child in the home or anywhere else, you must get a birth of certificate. For example, you buy a car or you sell a car, you must change it in 5 days. If you not registered this car, you will get a very big penalty. For that rules, most of ministry working preferably have got a very good database. For example, tax coming have got a very good database. Civil states have got a very good database. For more than 80% of ministries, which very important ministry, have got a very good database, and all the days they're updating, because our electronic government program is working very properly. For that, we have got more than 80% pure information. And what I can say, in this year, we have got another 10%, which is, for example, just 1 second. For example, person with disabilities have got a problems, where this year will do digitalization. Like that, some small problems, but it's not depending working on single register. For that, thank you for our president doing like that focuses. Is for that our informations, more than 80% is pure informations. Thank you.
Thank you, Mr. Otabek. Do I understand correctly that you just answered the question posed by Louis Frota in the question section about the completeness of the
yes
of the data available to the ministries?
Yes,
okay,
because very important, they are listening us and they are giving question, we must answer.
Absolutely, yes. No, I just want to make sure that we are counting. I'm sure which question you're answering. Thank you. We have Mr. Naveed Akbar here and invited him to also be a discussant. So I'd like to give him the floor now to give us his remarks and his impressions and questions.
Yeah, thank you very much, first of all, for such a wonderful presentation. And I must say that, I must appreciate the work done by the government of Uzbekistan for setting up this single registry. Because I believe that these registries serve as a backbone of any social protection program, and it helps improve the targeting systems. So, like, two important things in setting up the registry. First is actually itself setting up a registry helps you in identifying the vulnerable population, and you can quickly roll out any program. And I can see many programs being rolled out by government of Uzbekistan. In social protection, in the area of health, education, and persons with disabilities, so many programs. So you can quickly roll out different subsidies with the help of setting up the registry. And the good thing is that making the registry a single registry is something helps in avoiding the duplication of effort and resources, and you can plan resources very well by having the single registry. And it's something very remarkable to integrate the different organizations, different ministries database into a one single registry, because government of Pakistan is also managing National Socio-Economic Registry of roughly 35 million household, and we at the moment not able to make it a single registry because we have a different political party systems at provincial and federal level, and we are trying to set up a single registry. And what kind of issue we are facing at the moment is that we are facing issue of duplication of effort and resources, because many organizations are doing different initiatives, implementing different initiatives, and we are not able to identify the population getting benefits from the different programs. So it's wonderful and very impressive work done by the government of Uzbekistan. I have seen because the different slides, it needs a lot of technical capacity to manage this registry, and I would also like to understand that how now government of Uzbekistan ensuring that this registry is dynamic, and how they are recording the change of the socioeconomic status change in the household through this registry, how they are getting the updated information of these households or families. So this is something that I would really like to learn from the colleagues of the panelists. And also, so I may ask the question regarding challenges being faced by Ministry of Economy and Finance in terms of in the area of IT, because it requires a lot of expertise to set up this registry. So if you could kindly explain so that we can take it away and can implement in our country as well. So what kind of IT related challenges you faced, and going forward, how you foresee the sustainability of this registry in terms of funding, capacity, and technical expertise. So with that, I would stop here, and once again, I would like to congratulate Government of Uzbekistan for doing such a wonderful work.
Thanks a lot, Naveed. So the question that you concluded with is that, first of all, the main challenges faced by the Ministry of Economy and Finance, especially IT related. And the second part of your question was about sustainability going forward, both in terms of funding, capacity, and also technical expertise. So I imagine the first one is more on the IT side, and the other one is more on the policy side. The first one I would probably suggest to go to Mr. Otabek or Dorcas, but it's up to the panelists who would feel equipped to answer it.
Maybe I can take the first one on how you keep updated on the economic status of the different families. So the programs in the single registry, they all expire after 1 year. So after 1 year, the beneficiaries are exited, and then they have to reapply again to the program. Then in terms of monitoring, especially for the child benefit program, the system keeps track of the ages of the child. So if the child goes beyond the limit, the age limit, like they're over 18, the system automatically exits the child. If you get a new child and add it to the system, again, the system checks all this information. If maybe a family member dies, and so the database is always checking what's happening in the background. So the application is always kept up to date.
Can I just ask you then a quick follow-up question? You say the programs all expire after 1 year, and then one must reapply if one still qualifies.
Yes.
Right. Does that mean also that the system does not proactively identify beneficiaries that might qualify? It must be the beneficiary that applies and says, please consider me. And also, does the system itself keep the data for the next year already in there, or is it just discarded anyway because a new application has to be made?
So for the first part, for the maternity benefits, the system automatically identifies the beneficiaries, so the beneficiaries don't need to apply. So every time someone registers for maternity leave through the Ministry of Health, the system gets this information and then they do the eligibility check to see if they qualify for the benefits. But for the low-income program and the child program, they have to reapply again, and then the system will again do the data validation and verification checks just to confirm if it has changed. So with the new, maybe the databases were updated, or maybe they bought new properties. So every year they have to check again, but the applicant must submit an application, say I want to be considered for this program.
Thank you, Dorcas. Over to the other panelists.
I would like to comment on this. Yes, please. Yes, Dorcas was right to say that the order of giving benefits is such that after the term is expired, it has to be reapplied for. But I would like to underline that when we were planning to create a unified single register, our task was more global. We are going to widen the system stage by stage and perfect it. And in the future, yes, we are hoping that it will be proactive in looking for addressees of the benefits for people who are eligible for state support, and the system would suggest it automatically, but not all the automated systems and not the ministries who are responsible for submitting the data have good enough databases to give this information to us. So at the moment, we have to follow this kind of protocol to be based on applications from the citizens. Where we cannot be proactive at the moment. As for renewal of data, at the moment, the person submits the application, and over the whole period of payment of the benefits, we do not renew the information, except for civil registry, where we check the changes in the number of children that receive the children's benefits. At the moment, we are preparing the new methodology. I think we will recheck the system monthly, because we have had cases when the person starts getting the benefits, but over the period, excuse me, there is some kind of noise coming in.
Dominic, can you mute that person? No, it's done.
Thank you. So the system will be rechecked monthly, so that I tried to cover this issue, what we're planning to do and what we're doing at the moment. Thank you.
Thank you very much. Are there further interventions regarding the question of sustainability in terms of funding, in terms of capacity or expertise from any of the panelists? If that is not the case, I shall look further for the questions that also the audience has put in the Q&A box. And here there is a question by Michael that has also received an upvote about the unique ID. And he's asking whether you are creating your own lifelong social protection ID based on the national ID number, or is the national ID number, in other words, the PIN-FL, being used as that unique ID? And perhaps for the audience who those of in the audience who do not know Uzbekistan, maybe we can briefly explain who is who manages the PNFL system, and were there any challenges, both politically or technically, for you to use that PNFL as a unique identifier?
Thank you for your question. As I said, we have using PNFL as a unique number inside the database and inside of everywhere, because in our government say PNFL must be everywhere identification. One must be, because we are getting information other ministry and other information databases by the PNFL. And we are giving informations, for example, another ministry asking, have you got any social pattern for these people? We are asking yes or no. For that, they are giving us PNFL number. By the PNFL number inside the database, we are getting information and sending them this info. For that, we are getting unified number PNFL. This PNFL have got an inside national ID number, ID card, and citizen identification passport. Two of them have got a PNFL. Thank you.
Thanks very much. And can you just explain to us which state agency or ministry governs the PNFL system? Is that the same, or is that a different ministry?
Elektron hükümet Ümit'teki ortamdaş var ya, sorry, electronic government, they are giving us PNFL.
Okay, thank you. I'd like to check out the other questions here in the question box. Talking a bit about more about services. Here's a question from Friederike, specifically on disability. She asked, besides an allowance for parents who cannot work because they have to look after a child with disability, did you also consider providing daycare for those children instead, so those parents can actually go to work? In other words, is the system purely only allowance and money based, or are there also other services either now or in the works?
I think this question will answer Rafael, because it's political, it's not technology.
Yes, please, Rafael. Would you be able to say something to that?
It's a great question. First of all, I would like to underline that children and people with disabilities have the right for free medical help. At the moment, we have the Rehabilitation Center for Disabled People, and just recently there was a government decree about providing the rehabilitation services on the district service and on the Mahalli service. So we have a wide network of polyclinics, family polyclinics, covering almost like the whole population, and even in the distant towns and little villages, we have those, and they are supposed to provide the rehabilitation services to people with disabilities. As for providing the medical services at home, we have the special nurses, patronage nurses, and the number of those has been increased recently because we took the demand was taken into account, and considering the number of people with disabilities, the elderly people, the pregnant women, and the children under certain ages that are under ongoing medical control, I think we're going to include this question too about providing certain medical services at home. And in general, on call if the GP prescribes certain treatment, then the patronage nurse responsible for that is supposed to provide it. If the person is unable to come to the polyclinic and receive the service at the polyclinic, then the assigned nurse is supposed to, it's her duty to visit the person at home and to deliver the treatment. But of course, if the treatment presupposes the inpatient care, then we need to provide that.
Thank you, Rafael. In a similar vein, I see that the focus of the actual services being in place right now focus a lot on child benefits, on allowances to caregivers, on maternity benefits. So services focused around children and child giving birth. So I was wondering, where do you, or does the government of Uzbekistan see the priority going forward in terms of which areas of the life cycle would you like to expand the social protection services and schemes towards going forward?
In the future, we have outlined our future priorities in this strategy that we approved last year, and there are the main directions of work, including the following: the pension benefits, accessibility and availability of pensions for the whole population, covering all categories of population. We will guarantee the minimal pension package that will be available to all people, irrespective of whether they work or don't work. And the package will be defined in connection with the social status. Of course, the people with disabilities will have a separate package. The pregnant women and women who've given birth will be a separate package, and the elderly people will get a separate package. So different categories. We want to create the accessible social care to the whole population, irrespective of their social status, of their location, of their employment status and economic activities and all those things. This is the priority for us. This is the main objective. So in the first place, we're talking about the creation of the system of social insurance. And based on that, we will develop in this direction, creating the systems of social benefits and the social services in the first place, the availability of social services to all categories of population. That is included in our strategy, and we're going to go step by step in this direction. We are developing the roadmap at the moment, and we are legalizing it. And based on the results we have already achieved, we are going to create a new roadmap and then maybe check our strategy and make some corrections. So the main objective is to create available social care for every person.
Thank you very much. There's just time for the last question is also entered into the question box, which is again by Michael. Excuse me. How the system or the staff of the pension fund know that citizens do not hide any income streams so that they may qualify for benefits? Would anyone like to take that question? How are you sure you know that you have captured all the benefits? They don't hide benefits or incomes to qualify.
That's good question, because we have got a tax coming, official is incoming, but over the information system we cannot find. For that, our government say that we have got a on the mahalla, each one have got a person who is named mahalla hakim yardımcısı. For example, one mahalla have got a 4,000, maybe over the 10,000 of people. They have got a tablet on the hand and have got a system online mahalla, which can give a point. For example, very good house, very good incoming. is putting 10 point. If you have got a poor, maybe very bad house, they will put a 0. For that, we are seeing the of these peoples, we want to add an additional category. By the way, you cannot find the incoming of this kind of, because in USA or maybe South Korea, you cannot find this kind of incoming. Sorry, because it's a very good question and you cannot find because he is doing illegal or illegal incoming. Sorry, only we find this kind of way. If you have got any additional answer, you can. Thank you.
Thank you very much. We're almost running out of time. And Rafael, would you like to add something?
Yes, I would like to add that this is exactly why we would like to recheck the data monthly, on the monthly basis, to check the economic status of the families. That's number one. Number two, we're going to conduct monitoring through our social workers. We have three people in the Mahala. There is the assistant of Hakim. There is the women activist. She will be dealing with the women's problem. And there is a youth activist. So the three of those are have these tablets and they enter the data. And I think we are going to prepare the brochure that will have guidance on monitoring, on like target monitoring of people who receive benefits. They can make visits, they can study the family's economic situation, they can study the opinion and change the information in order to continue paying the benefits or hold the benefits because the status of the family has changed. Maybe we have detected that there are some incomes, maybe some illegal incomes or some hidden incomes, and they don't need the support. Thank you.
Thank you very much. I have several more questions that I would love to ask you here, but I believe the time is running out. If there's any of the panelists who would still like to have anything to add before we close, please do so now. Otherwise, we shall close here. And in a moment, I will be giving the word to Marina Novikova to close this session. From my side, I'd like to thank you all very much for your interventions, your presentations, the discussion, and the very, very illuminating answers. I'd like to also thank all the participants today for your time, for listening, and also particularly for posing these questions. So if any of the panelists or discussants would like to add something else, now is the time. Otherwise, I shall hand over. Thank you. Then, Marina, the floor is yours.
Thank you so much. I hope you can hear me well. Greetings to everybody. For those of you who don't know me, I am with the social protection team based in Tashkent with the World Bank, and we're working closely with many people who were speaking earlier today. I'm not going to take too much of your time. It's been an extremely interesting and useful and vibrant discussion over the past 2 hours, and I really hope that the listeners found it useful. I would like to really congratulate again our counterparts in the ministry with this really enormous progress that has been achieved in developing the digital and integrated social protection in such a short period of time, but also in a time which was really challenging for all of us. Rafael mentioned that the expansion of the single registry happened in 2020, right? This was in the middle of the COVID year where there was so much uncertainty and it was really hard process even without the COVID, but especially so. I really admire how much persistence went into this and effort went into this process during COVID. And then people already mentioned today this whole aspect of adaptivity of social protection, how important the registries and digital development play in this. But we actually already used the single registry for these specific purposes. Actually, in the COVID response, the World Bank support during the COVID response was specifically channeled through the already expanded by that time single registry, and we were able to reach about 1 million households at that time. And this was a transparent process through the single registry, and this was extremely useful. The final point I want to say is that, of course, we wouldn't be the World Bank if we didn't find something further to work on, right? But I wouldn't call these challenges. I'd rather say these are opportunities. And these digital developments, they bring many such things. We mentioned adaptive social protection, but there is also something which wasn't quite discussed today, is the whole aspect of better employment for people who are in some kind of a vulnerable situation. People in the registry, low-income families, but also people with disabilities and other groups of population which might require this support. So better linking with these types of services is crucial as we see it. And then we discussed the applications of case management, and I'm going to touch upon that. But I think one important thing about this case management is the opportunity for receiving a lot of feedback and information about the needs of the population. It's not just useful as a tool to deliver services, it's crucial in terms of collecting the data and analyzing it to understand better what is needed at the local level. And then you can plan better, you can bring together this discussion on the role of the NGOs or private sector in social service delivery at the local level, etc. So I really thank everybody once again for this exceptionally interesting discussion. And I think the organizing team also has a slide on the upcoming, if I'm not mistaken, on the upcoming similar discussions, which they might want to share. But otherwise, thank you so much thanks so much, yeah. These are the next ones. And thank you very much for the invitation to join today.
Thank you very much. I am not sure if I'm still closing or whether that is the closing, but thanks again for everyone. You can see on the screen the websites where you can also will find the recording of what we've just gone through, so you can revisit all the details. Thanks again. Thanks to everyone.
Thanks to for everyone.
Okay, thank you. All the best.